Doctors and nurses of Reddit, what self-diagnosis of a patient surprisingly turned out to be right. Story 1. My mom is a nurse supervisor at a nursing home. Multiple times, patients have walked up to her and said goodbye, that they're going to die that night, even though these residents have been perfectly mobile, and with it they have always been right. Story 2. My sister had a lump behind her ear that was causing her pain and was growing. My mom used to be a nurse and she thought it didn't look right. It wasn't just a cyst, so she kept monitoring it and started to become worried that it might be cancerous. For a whole year my mom went back and forth with doctors asking them to take her seriously, and one doctor finally agreed to go in and biopsy it. Lo and behold, my sister had stage 1 cancer, and it was a rare form at that. Story 3. Not a doc or a nurse, but back in the early 80s my mom, 30 at the time, could not convince several docs that she had breast cancer. It was different to just a lump or pain. They all responded with "you're too young." Finally got one doc to write a referral to a specialist so she would shut up about it. She had breast cancer. Was told she may need a mastectomy, but after going in they were able to remove enough without having to go that far. She went back to the original doc and had a go at him and said if she ever heard his name come up for malpractice in the future she would make a statement against him. She was in medical industry. Told him to never tell a woman she was too young for breast cancer. Edit. I called my mom for more details. It was in the right breast. There was no lump, just a dull and fairly constant pain, but not an intense pain. The mass was removed. However, years later she had same pain and had another mass removed. Years later again and had small lumps rice grain size show up on mammogram and removed. No pain with these. This seems to reoccur on average every 10 years. She also told the doctor he was a danger to women and should retire. Yes, we have good healthcare. Live in Australia. Both of us get annual mammograms. I am not between ages 50 to 75 nor related to a doctor, so it isn't fully subsidized. I go to a private hospital that does the ultrasound as well. My breasts don't mammogram very well, bill about $500, but based on family history I will keep going. Story 4. I read about a woman who had a voice in her head that kept telling her that she had a brain tumor. She eventually got tested and it turned out that she did have a tumor and it was causing the auditory hallucinations. Story 5. A man came in, saying he had an aggressive cancer on his back. He also told us that had run no tests, so we were skeptic, tbh. When we ran the test though, we saw he was right, seriously. Story 6. Not the doctor, but I went in because I had shingles. Told them up front I thought it was shingles. The doctor kind of chuckles and she says, "Well, you're far too young to have shingles, it's impossible." So I lifted my shirt and showed her my side where it was and I instantly saw her eyes widen as she goes, "Oh my, that is definitely shingles." The doctor and nurses were a little sheepish and apologetic, but they did a great job helping me get better. I was the youngest case they'd ever seen, early 20s at the time. Story 7. My mom went to the doctor's complaint about a pain in her lower back by her kidney. The doctor did a quick checkup and told her it was nothing, that she was probably just sleeping wrong. My mom mentioned cancer, and the doctor said that it wasn't very likely because people with kidney cancer don't usually feel anything. She was adamant that something was wrong, so she went to another doctor that told her the same thing but said he would run some tests to show her that it wasn't cancer. When the results came back from the test, it turned out she did in fact have cancer on one of her kidneys, and because she caught at such an early stage, they were able to remove it before it spread. Story 8. Not a doctor, but when my stepsister was 5, she told her parents she didn't want to go to school because she had appendicitis. They told her to pipe down and go to school. 5 hours later, she was in the ER with appendicitis. Story 9. Long time ago, a patient of mine in the mental health unit had a delusion that he had a bleed in his brain. Kept on it for a month. One night he actually did have a massive spontaneous intracerebral bleed. Poor guy died after that. Story 10. I had a spontaneous pneumothorax collapsed lung that came out of nowhere when I was 17. Had to go to the hospital and get a tube hooked up to my thoracic cavity to reinflate my lung. A week later I was in statistics class and I felt my other lung collapse. I immediately knew what it was. Kind of a weird but very distinct feeling of pain and shortness of breath. Cut to me in the school nurse's office trying to explain that I had a spontaneous pneumothorax and I need to go to the hospital. Yeah, she didn't believe me at first. Edit. Damn it, my first plat is for being tall and skinny. Story 11. Not a doc or nurse but a patient. I was having a kidney stone and my at the time took me to the ER. The nurse kept asking me what I did to myself because I was practically screaming in pain. Through tears I managed to get out it's a kidney stone. I then sat in the waiting room practically passing out until my somewhat yelled at the ER staff. They came over to get me and I couldn't even walk. The nurse said, "Well, are you coming back?" I said, "Get her a wheelchair." 6 hours and a round of morphine later I passed the stone. The nurse said, "Oh, look at that, it was a kidney stone." Like seriously, WDF. Patient here got into a car wreck and right arm started going numb a few weeks later. Self-diagnosed as disc pressing on spinal cord. Requested they do an MRI. Doc said to take more painkillers and it would go away. I don't like drugs so I insisted. Footed bill for MRI that insurance wouldn't cover because I requested it against doctor's wishes. Bulging disc on C56, 7 months of point and other non-painkiller drugs, arm works again. Insurance, doctors that push painkillers. Nearly done with the debt hole that entire debacle put me into. I was the patient in this case, but back in February I had all the symptoms of pneumonia and the doctor kept trying to tell me I had the flu until the test came back negative for the flu and the x-ray of my lungs showed I did in fact have pneumonia. I'm starting to think she was actually testing me for COVID though. Story 12. My mom was the diagnosee here. She had a coworker come to work with an active shingles rash a few years back. Mom was never vaccinated for chickenpox, nor did she ever catch it in her youth. A few weeks after this coworker decides to show up with live shingles, my mom starts developing this awful rash with lots of little sores, perhaps one may even call them pox, who would have guessed, along with fever, body aches, the whole kit and caboodle. Mom went to the doc and said I have chickenpox, and the doctor took one look at her rash and said you're too old to have chickenpox, it must be some other thing, I'm sending you to the ER. One very expensive ER visit and a nearly ruined Thanksgiving dinner later, lo and behold, she had chickenpox. We no longer see this doctor. Story 13. This is a little out there. There is a psychological condition that I can't remember the name of, where a person believes they are dead inside, not a zombie, not deceased, but more soulless. Many have a flat effect, rarely roused by stimuli, and have no fear of death, not looking for death, just entirely unconcerned by it. This guy was told to go to his doctor by his mother, due to him mentioning numerous symptoms. Turns out he had a severely massive end-stage colon cancer that had spread everywhere. Or sometimes you do a case knowing that you're mostly checking to see if it's a lost cause or not. Known as peek and shrieks, hope and nope, or under the hood ain't no good. There's other names too, I'm sure. Anyways, we looked inside this guy and he was such a case, a total lost cause, the irony being that he really was dead inside to a degree. Also that had he been more concerned with his health, he may have been more proactive in his care. So it ended up being a self-fulfilling prophecy. Story 14. Not a doctor, but the patient is a first-time mom. I got super ill with body aches, constant vomiting, fever, diarrhea, sore throat, the whole works. I was super dehydrated and begged my husband to take me to urgent care, but of course it was a Sunday so I ended up in the ER. I thought I had strep and or the flu because I was familiar with how that felt and this was similar. They tested for both and it all came back negative. Super odd. They gave me fluids and sent me on my way. 2 days later, my 1-year-old daughter got spots on the palms of her hands and soles of her feet. We took her to the doctor and turns out she has hand, foot and mouth disease. If you're familiar with HFM, you know there's nothing you can do to treat it, and by the time the spots arrive, the illness stage is usually over and you feel better besides the fact that you have itchy hands and feet. So while I was there I told her doctor that 2 days before I admitted myself to the ER because I was so sick, yada yada. And does she think I could also have HFM? She said it's a children's disease and I don't have it. Well, 2 days pass and now I have spots on my hands and feet. I had HFM and the ER and pediatrician didn't catch it. Not that there was anything they could do, but would have been nice to know. Editing to add, I never even knew my daughter was sick before the spots appeared. She acted totally fine but it put my butt in the ER, and yes, her pediatrician dismissed the idea of me having HFM so fast. Good to know other adults had it bad too and that it hits adults harder than children. Story 15. I am neither of those. But when this question came up a few months back I remember someone saying that a man came in because when he peed outside his pee attracted bees. Therefore he thought he was diabetic because sugar attracts bees. So he got some tests done and turns out he was right. Story 16. Not a nurse, but my mother worked at a children's hospital in X-ray. Her second-born, not me, was vomiting and having symptoms as soon as he was born. She believed it was pyloric stenosis, a fairly rare case where the sphincter in the stomach closes up, preventing eating. The first doctor dismissed my mother, thinking she was being normal mother paranoid. My annoyed mother brought her to a second doctor. The second doctor called in his med students and said, "This is a baby with very, very early onset pyloric stenosis. You will not see it often this early." The mother just recognized it. Story 17. My wife visited a gastroenterologist at a renowned multi-specialty clinic, complaining of severe pain in her upper abdomen, not all the time, but mostly after meals. The doc poo-pooed her concern, saying it's only indigestion and advised more water, analgesics etc. She insisted on getting a USG scan done. The doc almost sneered, saying you must have checked the symptoms on Google, but just to put your mind at ease, let's get it done. While we were waiting outside the radiology room, the doc came by, with the same all-knowing smile on his face. So, it's all fine isn't it? The lab guy came out just then, saying, "Ma'am, you've got lots of stones in your gallbladder. You must see a doctor immediately and get it operated." The doc hastily beat a retreat. We've never gone back to him again. Much ado about everything. Story 18. Not a doctor, but when I was in early grade school I had an accident on a trampoline and thought that I broke my knee. We rushed to urgent care and they said that I was just bruised. The following week, still in PE and running and doing sports, my knee still hurt and we went to the doctor again, not urgent care, and I fractured my femur right above my knee and had to be on crutches for 2 months. Also the second time I got a concussion I was rushed to urgent care and they said it was a migraine. I knew I had a concussion and so did my family. I ended up taking 1.5 months out of school and did part-time for another month. I don't trust urgent care. Story 19. After drug abuse I was left with permanent lasting visuals. It's called HPPD, hallucinogen persisting perception disorder, basically anxiety up the 8 different visual disturbances that are continuously happening no matter time of day, open or closed eye, light or dark. Went into a treatment program after some issues with Xanax. Used it because it took away my visuals. I told them I have HPPD and that I see things that aren't there. They said that's not true, you're just trying to get a Xanax prescription. Fast forward 3 months and I'm out, still being told I'm making everything up. They convinced my family I was lying. Went back to my OG therapist that I've seen for 2 years and she's been with me the whole time through my struggle with HPPD. After a year she said she was comfortable diagnosing me with HPPD. Doesn't change the fact I still see 247, but hey, at least I was right. Story 20. I'm also not a doctor, but I found that as a relatively young person, unless you turn up with a direct request to check for something specific, things tend to get overlooked or dismissed because you aren't old enough to have pain, be exhausted, whatever. I've self-diagnosed a handful of things and been correct, but I had to push to be heard. Story 21. Not a doctor, but the patient. Back in late 2016, I was 13. I started experiencing things like fatigue, joint muscle pain, intolerance to exercise, migraines, depression, etc. I consulted Google with my friend, and the first thing that came up was chronic fatigue syndrome, hemialgic encephalomyelitis. I never really bought it up and got told I was just depressed. Well, lo and behold, 4 years later, now 17, after seeing approximately 10 different specialists, I get officially diagnosed with chronic fatigue syndrome. Sometimes it makes me wonder what my life would be like if I got diagnosed 4 years ago. Story 22. My dad is a neurosurgeon, and my mom thought I was having absence seizures. I basically zone out and forget what happened from the past 10 minutes or so, and my dad said I was just ignoring my mom. My mom took me to go get a EEG, and turns out I have seizures, pretty strong ones. EEGs can take up to 2 to 3 hours long, and mine was 15 minutes. We walked to my dad's hospital, and my mom walked in flaunting the papers saying I knew it. I'm smarter than the neurosurgeon. Haha, edit. I just remembered something. When I had my seizures I was on meds, and now I'm off. We are waiting to see if they'll come back. I had to have someone check on me every few minutes to make sure I hadn't drowned. I couldn't drive, still can't, or swim, or hardly do anything by myself. Makes you appreciate alone time. Story 23. Not a doctor, but I started having severe excruciating headaches come on when standing, or coughing, laughing, etc. They became so severe they'd make me scream and vomit, but would disappear as long as I was bent over and hanging my head, or if I took crazy amounts of caffeine. Because the headaches were positional, I thought it was a CSF leak and that I needed a blood patch. One morning my husband drove me to the ER, which triggered a headache, so I walked into the ER bent with my head hanging and saying I had a CSF leak and needed a blood patch. They did an MRI and it turned out leaks from Chiari, so I was right about the leaks but wrong about the treatment, and I got brain surgery instead. Story 24. I had an abscess tooth that the infection had become so severe that I lost vision in my right eye. Went to the ER and they told me it was pink eye. I tried explaining that over a couple days I literally felt the infection move from my tooth, through my nose and into my eye. They said that doesn't happen and sent me home with eye drops. 3 days later I had a face that was swollen twice the size it should have been. They removed the tooth and put me on antibiotics. Story 25. Patient in a care home was complaining of eye pain and facial tightness. She told me it was shingles. I reported it to the physician and supported that it did look like shingles. Doctor did not believe me or the patient. Poor lady suffered for several days until the night staff sent to the hospital. Guess what? Ocular shingles. Story 26. Since I'm not a doctor, this probably doesn't count, but someone in my school diagnosed themselves with diabetes since they're addicted to eating sweets every hour. Turned out to be true. Story 27. Obligatory. Not a doctor. I had a lumbar puncture done 2 years ago that got me a CSF leak. I had that leak for 8 months. The doctor that was responsible told me that it's impossible. Your leak must have sealed. I took matters in my own hands and wrote a letter to the neuro department at my local hospital, basically laying down my thoughts and telling them I strongly believed I still had a leak after 8 months. They took me in and treated it. It doesn't end quite there though. After treatment I developed what is thought to be RIH, rebound high pressure. This is a newly researched phenomenon found in patients that are treated for a CSF leak that have had the leak for a long time. Basically your symptoms switch from low pressure to high pressure. I had to research this on my own as well and reference some articles to my neurologist. My neuro then said, wow, we have never heard or seen anything like this before, but the articles you show me are written by respectable experts in the area and published in very good journals. So let's try to treat it. Now I'm being treated for RIH with Diamox, which seems to be slowly working. So I had to basically self-diagnose twice. It is honestly not fun, it is exhausting and stressful, but you have to do what you have to do. I've made sure to read highly cited research and then bring this forward to my doctors and hear what they have to say. Story 28. I've told this story before. I had a 65-year-old female patient with a history of well-controlled hypertension and diabetes. Otherwise healthy. She woke up in the morning and told her daughter that she would die that day. She had breakfast. She demanded that the daughter take her to a lawyer to make a living will in order to make sure that she would be DNR when she died. The daughter humored her. She then had lunch at a restaurant. At 4 p.m. she collapsed. She came to the ER where I saw her. The daughter presented the living will to me. She died at 5 p.m. comfortably. Story 29. Not a medical professional, but years ago my father had gotten a rescue dog, and was convinced the dog had a broken leg. Even though the dog didn't limp or show any signs of pain, the vet wasn't convinced, but my father insisted on getting x-rays. Turns out the dog had a fracture in his leg from before his adoption. Fortunately the fracture healed well, and no further action was necessary. Story 30. I'm not a doctor or a nurse. I am a CNA though. My son had croup, and with having asthma, he was having a harder breathing time, so I took him into the ER mid-morning. I told the doctor he has croup because of all his symptoms. Also it's not his first time having it. The doctor told me it was impossible because it was daytime and croup doesn't appear around daytime, but must be something else, so we ran all the tests, even though I knew it was a bad case of croup. Well, my son finally coughed, and it's that seal bark cough. He looks at me and was like, "Oh, it is croup. I told you it was." He now knows that croup happens during the day now. SMH. Story 31. Not the doctor, but the patient. This was around fall 2019. I was working in the kitchen of my local bar, getting close to closing time, so I was putting things away and cleaning. I'm not entirely sure what caused it, maybe moving something in a weird angle or the chemicals used to clean the flat grill, but my chest was hurting me whenever I moved. I worked like this for 2 hours and it kept getting worse to the point that my body was contorting to compensate. After my shift I sat down at the bar and had a beer, chatting with the head cook, and told him I think my lung has collapsed. Now I'm fairly skinny, 63 and was 28 years old, but I look like I just left high school. He thought I was being dramatic, so I go home and have my roommate take me to the hospital because it's just getting worse. When I arrive I tell the front desk I'm having chest pain and I think my lung is collapsed. ER doctor doesn't believe me. I told them I vaped and he assumed it was all due to vaping. Well, get an MRI and I have an 80 collapsed lung. Watch them cut my chest open with a scalpel and ram a tube into my chest cavity. They said it was due to my BOTUS build, spontaneous pneumothorax due to being tall and skinny. Was in there for 4 days and the nurses kept bringing up that I diagnosed myself. Luckily no long-term effects other than I can never go scuba diving now. Story 32. Patient came in with his wife for fever and malaise. I'm asking my history questions when the patient says I think it's Legionnaire's disease. I just kind of chuckled as he said he wasn't in medicine at all and Legionnaire's is extremely rare in my area and quite rare in general. We tested for it anyways and sure enough, positive for Legionella. Story 33. Far less dramatic than other people, but I grew up in a fairly medical household. I'm not a medical person myself, but I have enough knowledge to know when to see a doctor. When I was in my early 20s, I took someone to the emergency room one night because they had a badly infected wound. When I told the middle-aged doctor that it was an infection, he chuckled and said, "Don't be silly. I'm sure you just mean that it's inflamed." I told him yes, it's inflamed but is also infected. He rolled his eyes at me like sure thing. Little girl. The nurses and other doctors chuckled. The doctor then looked at the wound and said, "Oh, it's really badly infected." He wouldn't make eye contact with me after that. I guess it's not quite the same thing, but it just annoyed me that instead of just saying cool, let's see this thing, he had to argue with me and try to make me feel stupid in front of his colleagues. When something is slightly green and bright red lines are spreading out from the wound, it's infected. Even a non-medical person can tell you that. This isn't rocket science. Edited for typos. Disclaimer: there may still be typos. Story 34. I had been battling stomach pain for years and it fluctuated between dull and sharp 1010 pain every couple of weeks or if I ate something new exotic. Also felt tearing in my abdomen and experienced bloating like crazy. Told doctors I thought I had Crohn's disease and they thought I had a hernia. Lo and behold, moved cities and got a new doctor. Doc schedules a colonoscopy and got diagnosed with Crohn's right when it was finished. Story 35. I wasn't going to post since I'm the patient, not the doctor, but I have a complicated medical history and all of it I've had to research myself. I have a genetic connective tissue disorder, hypermobile Ehlers-Danlos syndrome, so joint pain my whole life, which I assumed everyone had to deal with since I was always brushed off. Orthostatic hypotension, so I constantly hear with that blood pressure you'll live forever. And I think reply it would be nice if I could stand up for more than a few minutes at a time though. I thought I was a hypochondriac most of my life, until I caught myself and said out loud, right, I shouldn't kneel like that, I might dislocate my knee again in front of someone who had EDS and they asked if I had it. Eventually I researched, and then pushed for a diagnosis. Ended up having to go out of state to a specialist because no one here was willing to say I had it, even though the evidence was where they would treat me like I did but weren't comfortable writing it down. I'm almost 35 and my quality of life is that of a geriatric. If it had been caught sooner, if insurance would cover continuous physical therapy for people like me, maybe I wouldn't be where I am. I also want to go back through my laundry list of doctors who brushed me off and tell them to pay attention. Story 36. I'd like to point out that, many times, I felt weird and not right, and once I see a doctor, they almost automatically think you're self-diagnosing or it's all in your head if you are a doctor reading this. And these many other accounts. Please don't just dismiss someone and make them feel like their pain or worry is something to be taken lightly. Especially when it comes to mental health. Stop 21 questioning people. They come in with an issue, you should do your best to resolve that issue. Dismissing patients is clear evidence that you don't take your job seriously, or the health of your patients. Edit. Thanks a non-user for my very first award. Story 37. Not a DR but have an interesting story that relates. Little backstory first. I had my first son at 18 with my girlfriend at the time who was a little psycho to say the least. We split up after 2 years and while she made me life I stayed super engaged in my son's life. When he was about 5, she decided to go in for a hysterectomy. A day after the surgery I get a call from her mom asking me to go to the hospital. Apparently she's in a mood and not talking to anyone and her mom hopes maybe she'll talk to me. I go to the hospital that evening to talk to her. She's just staring at me while I talk. About 20 minutes and I decide there's nothing I can do and say goodbye. I go to give her a hug and notice her fist is clenched. I don't think anything about it and start driving home. Once I got home I started thinking about how speech is controlled by one half the brain and was thinking of the clincher first again, so I decided to go into my work to do some internet research, obviously before smartphones. I look up strokes and find it pretty obvious she had one. I called the nurse at the hospital, tell her what I realized, and went home feeling like I did a good deed. The next morning I get a call from her mom saying they're going to transfer her to a mental facility. Doctor said she has a history of depression and this was obviously her acting out. I talked to my boss and told them I needed the day off so I could go to the hospital. I get there and sit with her for a good while being ignored because I wasn't a family member. Eventually a doctor comes in to sign off on the final transport orders and pretty emotional. He asks why I'm crying and I said, well, to me it's pretty clear she had a stroke, but everyone here seems incompetent of a diagnosis. He asks me to leave the room for a minute so he could do an exam, and 2 minutes later comes out to confirm that she did in fact have a stroke. Story 38. Not a doctor, but almost 30 years ago I was pregnant. I knew something wasn't quite right because I was experiencing intermittent spotting that was getting more frequent. I called the OBGYN's office a couple times, trying to get in to see him earlier than the initial appointment ID set up at the 12-week mark. Both times his staff just told me that spotting was normal this early, nothing to worry about. No, the doctor didn't need to see you early, blah blah blah, writing it off to an over-anxious first-time mother. Found out later from a friend in med school that if ID mentioned that the blood was dark red, which it was, but I didn't know this was relevant at the time, it would thrown up some major red flags for the staff. Lesson learned. So 2 weeks drag on with me knowing something is wrong, but the staff isn't listening. My boyfriend is telling me I'm overreacting, even though it's becoming painful. I didn't have insurance and this was pre-internet, so I was literally stuck and panicking. I was able to do enough research to suspect it was an ectopic pregnancy, which meant there was no way to save the fetus, and accepted that the fetus was probably already dead, and was just trying to figure out how to avoid dying. Ruptured ectopic pregnancies can cause you to die from internal bleeding, FYI. Long story short, one day I get hit with the worst cramps I've ever experienced. I'm pale and sweating profusely, drive myself to the doctor's office, practically crawled into his office. Within 15 minutes I'm in the ER. A few hours after that I'm in emergency surgery because of, surprise surprise, a ruptured ectopic pregnancy. Story 39. I went to the doctor 6 months ago with a small lump inside my belly button. Booked straight in with a surgeon instead of the GP because I knew it was a small umbilical hernia. I told him that, he sent me off for an ultrasound, came back as indeed, an umbilical hernia around 1 centimeter, booked surgery for 3 days later and got it fixed up. He couldn't believe ID correctly diagnosed it. Story 40. Not a doctor, but a pretty wild story. About 7 years ago I began to notice a super erratic, but incredibly severe shooting pain in my left foot. What began as random twinges progressed over the next 4 years into an almost constant, cattle prod-like pain. Initially, I saw a podiatrist who said everything was normal aside from some synovial swelling and inflammation. I was told to take Advil regularly. Over the next couple of years, I saw neurologists, general physicians, physical therapists, pain management doctors very expensive, and multiple rheumatologists. In about the 3rd year of dealing with this, I developed a stress fracture on my opposite hip, which put me in crutches for a month. The sports medicine doctor who treated me couldn't understand how a 26-year-old would develop this type of fracture with normal bone density. When I told him it was because I couldn't put weight on the other foot and pointed out a strange lump in the calf above my painful foot, he told me it was a muscle knot, as did every other medical professional I spoke to. Keep in mind I live in NYC, so these were top-of-the-field medical professionals. I had a hunch that it was a tumor but would get laughs and eye rolls from doctors and friends whenever I would suggest it. When one doctor recommended psychiatric help for my hypochondria, I essentially gave up and figured I would have to live with the pain. I've never felt so crazy or hysterical as I did being constantly ridiculed, judged by the doctors I was trying to communicate my concerns to. I went from being a daily runner to not being able to walk without a limp and losing a ton of function in my leg. At this point, it had been about 4 years and the pain was unreal. I have a huge pain tolerance, but I would sob silently at my desk during work hours, and sleeping at all during the night was a thing of the past. It was pain I wouldn't wish on my worst enemy, like a mix of burning, shooting, stabbing, electric jolts that literally made me cry out. And toward the end, it was happening at 2 to 5 minute intervals, all day, all night. When doctors weren't able to find a cause for it, my final rheumatologist decided that I should be put on immunosuppressant therapy. I have psoriasis, so psoriatic arthritis was their best guess. I finally put my foot down and threw a tiny tantrum in the doctor's office. After pointing out again the growing lump on my calf, and being told again that it was just a muscle knot, I demanded to have it imaged before moving forward with treatment. ID Googled symptoms and was firmly convinced it was a schwannoma or similar nerve sheath tumor. 15 minutes later, the ultrasound tech confirmed that's exactly what it was. Her exact words were, "Damn girl, you were exactly right, good for you for advocating for yourself." The relief for having a cause for years of pain is tough to describe. I eventually had the tumor imaged and evaluated, and after a scare that it may have malignant qualities, had it removed by a top surgeon at Johns Hopkins. As it turned out, it was an extremely rare hybrid of 3 different nerve sheath tumors, and had grown within my tibial nerve, 3 inches of nerve graft later and 0 pain, almost full feeling back in the foot, and nearly perfect mobility. I will never forget how stupid doctors made me feel as a female, and how quick they were to dismiss my pain as a symptom of psychological hysteria. I don't think that would have been the case had I been a man complaining of severe pain. Moral of this long story: be your own advocate. We aren't all doctors, but we know our bodies. Story 41. I had a massive vertigo spell back in 2016. My world spun for months. Aside from it being to try and see the ENT specialists and brain specialists, the overall diagnosis was migraine aura without headache. After the medication they put me on gave me a reaction, they didn't try anything else and basically set it up, despite the fact that I insisted that it had to be something else, because all the vestibular therapy they'd assigned to me wasn't working. Move to TN, start having more episodes, go to Vanderbilt. Turns out I have bilateral peripheral vestibulopathy, and it's fairly uncommon to see a young person with it. 25F. It's an everyday struggle, but let me tell you how vindicating it was to know I was right. Story 42. I remember I was suffering from low hemoglobin count and bordering on anemic. It started shortly after I began taking new meds. I asked my doctor if it was the reason why, and she said no, it was probably because I was donating blood regularly. I was confused as to why it didn't develop before, since I'd been donating since I was 18 and was almost 40. I kept bringing it up and she insisted the drugs were not the culprit. I finally asked about side effects of each drug. She said one of the drugs can cause a certain change in my blood, which then causes low iron, which then causes, low hemoglobin. Story 43. Obligatory. I was the patient here. I discovered that phimosis ran in my family and I had it. When I was born, the doctors refused to circumcise me because I wasn't Jewish. The first specialist I spoke to told me I didn't have it and I was just being ridiculous. Despite explaining that I cannot have due to this issue, he made me leave his office. I then got a referral to a different specialist in another city, where I was told my concerns were correct and I was permitted surgical intervention. Downside was I ended up with nerve problems post-surgery, and cannot feel all most of the time down there, but I was right.